Welcome to Vedhika TV viewers. In our daily life, we must have faced many issues or injuries or pain related with foot, ankle or joints just by walking or running or just by mopping the floor. What we do at that time? We just apply painkillers or consume pain tablets. But how effective it is? Let me introduce you Dr. Pradeep Moonot, who is a renowned orthopedician working in Mumbai and Hyderabad. He is super specialist in foot, ankle and sports medicine. Let us talk to Dr. Moonot and know much more details about it. Hello, doctor.
Hello,
How are you, doctor?
I'm fine. How are you?
I'm good. Many people suggest like barefoot walking is very good. Walking on the grass is very good. So what do you suggest?
I think it's a very new Western concept, let's put it that way. Because in India, I don't remember when I was growing up, I was using chappals at home. All our ancestors, look at all the houses, big houses, people would be walking barefoot. I think it's a very good thing. You can activate your senses. Feet have receptors, so they activate it. Of course, barefoot walking helps in developing your foot muscles, help in your proprioception and joint sense, helps you develop your biomechanics of your feet very well. They are very good. Barefoot walking helps in developing the arches as well, which is fantastic. And because of that, also your knee alignment and your back alignment is better. That's all well and good. Of course, walking on good surfaces, grass or a turf is good. No doubt about that. But hang on, only the solution? I would say no. You have to be careful where you're walking. Now, suppose you start walking barefoot on a tar road or a cement road. I think it will cause you more damage than good. Okay. Also, you have to be careful if you're going barefoot walking on the road. There are objects which are there. It could have a glass piece, cuts or anything, and which can go in your feet and cause you infection. So just be careful. Also, one of the most common things which I see people walking barefoot, especially in public places, saunas, swimming pools, they catch infection, they catch warts. So that's another downside to it, fungal infection, not a very good thing to do. And also depends on the type of a feet which you have. People who have a very bad deformed foot or a flat foot, or people who already have an existing some mild heel pain, you start barefoot walking, your condition can get aggravated. So just be careful. In those people, I think wearing a minimalistic type of a footwear or a minimalistic footwear.
So you said about the flat foot. I have a cousin who is 16 years old. So he's suffering with flat foot and is not able to walk properly. So in this age group, what kind of remedies are available for the flat foot problem?
Very interesting point, and it is one condition of flat foot which is very close to my heart, and I've been a very big proponent of management of patients with flat foot in India. Okay, because Indian flat foot is different than Western flat foot. As of now, all the data which is available in the management of people with flat foot is from the Western literature or in pediatric group. In adult, so 16 is almost coming to an adult flat foot is different, because as Asians, collagen or ligaments are different. We are more laxer, we are more flexible. So that's why people have more lesser arch, let's put it that way, a lesser arch than a person who's developed, or a Caucasian or a European. So we are developed with a slightly lesser arch or flattish. But not every person needs treatment. Just because somebody has a flat foot and is no symptoms, is very active, doesn't need to come and see me. That's fine. 21% of Indian population is flat foot. That's a lot of patients. If everybody starts coming and seeing me, probably it'll take me 2 year life to see them. So I'm not saying you need to see them. But if you have symptoms with your flat foot, and the symptoms could be just not pain, right? Like 16-year-old, your cousin, he may not tell his parents or himself that he has pain, but there could be underlying symptoms like limited activity. He doesn't like sports, he doesn't like doing sports, he doesn't like to run, he's not very active in participation, he could be having a sedentary life. These are all symptoms of flat foot. So what we call these are psychosocial symptoms. If they are there, they should be treated. So a lot of my colleagues and say, oh, there is no pain, don't treat it. No, these are other things to be looked at and need to be treated. Also, because of flat foot, because of a misaligned foot, you can have a misaligned or a knee pain. You could have a back pain or a lower bottom buttock pain and the whole spine. So these are like a cascading effect of flat foot on the whole body. So these are symptoms which should be treated. How do you treat this? Not every patient needs surgery. Initially, simple things. Align them properly. How do you align them? Give them orthotics or insoles. Initially, if it is only mild flat foot, you can do off the shelf insoles. You can have silicone insoles, or now you're having off shelf insoles, you can use it. If they are not happy with that, then you have customized insoles. Pressure measurements are taken properly, both in terms of standing and while walking. We look at that pressures, where abnormal pressures are coming, and you offload them or correct them. In the past, we had a lot of people putting just a small arch in that. No, flat foot is a three-dimensional deformity. Just putting an arch on the inside does not work only. You have to correct the arch, but at the same time correct the heel. At the same time correct the forefoot. So it is a three-dimensional deformity which needs to be corrected appropriately with insole. So in my team, I have a orthotist which is trained with me, who works and sits with me for every patient whose insoles are made, and I make sure that that person is happy with that insole. Now the other common downside to it is patients are given insoles, they wear it, they come back after 3 days, my pain has increased, I don't know, I don't want this insole, and they throw it away. But understand, he's a 16-year-old boy or somebody who's 60. They have walked always flat foot like this. Now suddenly you tell them to walk in a different way. It will be very difficult. It's like buying a new shoe. Would you be able to spend the whole day in the new shoe? No, you don't. Same thing with insoles. You have to get used to it. So I tell all my patients, you wear only 15 minutes to half an hour next few days. Take it off, then again wear it. So your body gets used to the new alignment. I always call all my patients between 2 and 3 weeks again to check what is happening. Are they happy with their insoles? If they are not happy with the insoles, how we can correct it? And also initially we just do a mild correction. Once they are comfortable with that mild correction, then we increase the correction. It is all about a gradual process and a relationship developing with those people. Along with the insoles, physiotherapy or physical therapy is very, very important. You have to stretch some muscles and you have to tighten some muscles or strengthen some muscles which support the arch. Okay, one of the muscles which is behind on the inner side of the ankle, which is called as the tibialis posterior muscle, which is the key muscle which maintains the arch, that needs to be strengthened. That is the most important thing. If, lo behold, your 16-year-old cousin is still symptomatic or is not relieved of the pain in spite of all this, then we have to look at what other options can be done, like surgery. We can do minimally invasive surgery where the whole flat foot can get corrected by a small, less than a centimeter incision. We have a special, what we call as a stent, and I call it as like an internal insole, where through a small half a centimeter cut, I correct the whole flat foot and patients can walk from day one. Okay, that is called as a EOTTS or hyprocure. Okay, that's a arthroresis type of a procedure. Elderly people or older patients with severe deformities, if it is flexible, I can still construct or realign the foot and still maintain the mobility. It is called as a flat foot correction. That's what I do it, where we realign the whole foot, and they need to, it's a long process of rehabilitation. Takes around 3 to 4 months for them to get back on their feet and back to their whole life, but they are much happier. At least they're happy that the alignment is better, pain is gone, and future risk of arthritis is reduced. Now, there are some patients who have not taken care of their joints and come too late, where the joints are starting getting arthritis, especially around the ankle area. In those patients, there is no option but to realign it, but we have to fuse the joint. So we join the two bones. In the process, we give them a good foot, which they can walk on it, they can walk pain-free, but they lose a little bit of flexibility or mobility in their foot. But they are still better off than what they started with. So it's all about what you gain from the surgery versus the risk what you go through it. So that's in a nutshell about flat foot, but do not ignore it. Because if you ignore your flat foot, it's just not the feet which is taking the pounding, it's your whole body which is going to get affected.
So as you said, for the 60 years and the 16 years of age group also is having the treatment. Can we at the initial stages only, like 4 to 7 age group, can we correct that flat foot?
Yes, usually few of my patients or the parents come with their children at a very young age and say, "Oh, I don't think so. He has got any arch. What do you think it is? Does he have flat foot? Shall we treat it?" No, actually, the arch development, or actually, if a person or a child has an arch or not, we can only start looking at it by age 6, 7. Before that, it is all baby fat. So I just reassure the parents, give them some exercises, give them some stretching, because strengthening is not possible, but stretching and other things, and reassure them, then yes, we will be taking care of them, but they can come back and see me every 6 months and see how things are going by. If the deformity or the out of alignment is going more progressive, then we will treat it. Otherwise, just keep an eye on them. Age 7 is the time where we say, does this patient or this person has flat foot or not, and that requires treatment.
In our olden days, we have to see 60 to 70 years of age group used to have joint pains or ankle related pains. But at present generation, we are seeing at the age of 40s or early 50s, mostly in the IT industry, people are complaining about the joint pains. So what do you say about this?
Let me start by saying there are two parts to it. One is, in a previous, we would say, of grandparents' generation, life expectancy was only 60 to 70. Now we are looking at expectancy of at least 100. We are almost touching that as what we would do at the western side. So people have become more active. Now, if they become more active at 60 and 70, so whatever is related in terms of disease, like in joint pains, arthritis, they want to get treated about it. My grandmother, she was like 60, arthritis, she didn't want any treatments. But the present generation wants to get treated. So that's why the surge in the number of people seeking treatment is there. The younger generation, and as you mentioned, IT industries and other industries, the lifestyle has become very sedentary, you know. So the previous generation, they were very active. You didn't have the likes of home deliveries and the Swiggies and the Zomatos. So people used to go out, used to go work around, walk and do other activities, which made their joints more active, mobile. The present generation, I wouldn't blame it on anybody, but it's become more sedentary, non-active. So that's why you have more increasing joint pains. Obesity is to a very high level. And of course, then you have other issues as well, thyroid and other things. So all in all, because of this, the bone and joint related issues have taken a big jump in our practice. And that is why I would say people having knee pain, foot pain has increased recently.
Suddenly we might fall from the steps, or while walking or running, we might get sprained. So generally we just spray something. So is that effective, or are there any medicines or remedies?
Ankle sprains is very common. One of the most common causes in India of ankle sprain is not sports related. It's usually because of bad roads or pavements or walking on uneven surface where they have a mild stumble. Now the key is, how bad was the stumble, how bad is ankle sprain. If it's just a mild swelling and they're able to carry on, so a lot of patients may say, I haven't sprained, they carried on for doing whatever they were doing, and in 1 2 days they went to see a doctor because there was mild swelling. That's a different kind of ankle sprain to a somebody who really has a very bad twist, sudden swelling, here's a pop, suddenly they cannot even stand and walk. Okay, so that's a gradation of people who are having it. In the first case, yes, icing, so what we call is a price or a rice treatment, rest, ice, cold compression and elevation should work, and they should settle down in 5 to 7 days, maximum 10 days. To somebody on the other side where you have a lot of swelling, can't even stand and walk, not able to do anything, on those cases they should be seeking a doctor's appointment immediately, probably having an x-ray, seeing a specialist, orthopedic surgeon or a foot and ankle surgeon, and treating it appropriately. Appropriately means, of course, rice treatment, but at the same time, they may need a short form of immobilization, like in a plaster slab or what you call as a walker boot, for 2 to 3 weeks, not more than that. And the main thing in any patients of ankle sprain is rehabilitation. And when I talk about rehabilitation, means exercises and physical therapy, and that should be carried on for approximately 6 weeks to 3 months, because when you have a sprain or a torn ankle ligament, you need to make sure that the muscles around the ankle are made strong, that they do not have a repeat ankle sprain. The problem is not just having a sprain, the problem is having this kind of pain and instability over a long period of time, the ankle giving way, you don't have confidence in your ankle, and thereby limiting your activities. Also, if you have a very loose ankle, the chance to the damage to the cartilage leading to osteoarthritis is very high. These loose ankles can, over a period of time, what you call as ankle instability and arthritis, which then you need further treatment in forms of surgery, either a fusion or an ankle replacement.
So, what are the new developments regarding this?
We know the fact people having hip replacements, knee replacements, it's like a common thing. It's like drop a coin, go have a knee replacement. But ankle, if people have ankle arthritis, then people just think of, yes, the bones need to be fused. However, ankle replacement is definitely an option now in India. In the western side, ankle replacements been there for last 20-30 years. Just because of non-availability of the implants and proper training, it was not available in India. Till recently, I was the first one to do a live ankle replacements, and more than 8 ankle replacements. I have done it in the last few months in India, and we were the first one to do H3 ankle replacement in India. Patients have been doing very well. The pain goes away, mobility is still maintained, walking is better, and you restore the ankle movement. Ankle is a joint, right? So you have to have movements. You could do a fusion surgery. It is a good outcome. It's also still a gold standard for a arthritis. But over a period of time, you can have surrounding joint arthritis. That means the surrounding joint around the ankle can get wear and tear over the next 10 years. Now you understand, if you have a young person where your ankle is fused, in 10 years time the surrounding joint get arthritis, you have to fuse those joints. So what you are doing is you are fusing one joint over a period of time, one to another, and you giving them a very stiff foot. Okay, that's not what you want. We should always weigh the pros and cons of fusion versus ankle replacement and consider an ankle replacement in appropriate people.
So, how is this diabetes related with the joint pains? Can you enlighten about that?
So diabetes directly is not related to joint pain, but again, with diabetes, you have a lot of other issues happening. And the key thing is diabetes is a multifactorial thing. It is just not your glucose or your sugars are not controlled, but at the same time, it is affecting your joints, it is affecting your nerves, it is affecting your blood circulation. Indirectly, with what happens is, if you have a bad or poor blood circulation, you have injuries which do not heal. You can have high risk of infection, bone infection causing osteomyelitis, and you can lose your foot, or even knee or below knee amputation is very high. That is on one side. Other side is, with diabetes, what happens is, if there is an excessive circulation and you do not take care of your joints, there is something called as a Charcot neuropathy. Now, Charcot neuropathy, what happens is, because people lose the sense of joints, they do not know where they are placing their foot, though they could be placing it anywhere. And there is a gradual destruction of both bones, joints, and ligaments. And ultimately, what happens, the whole joint becomes malaligned and destroyed. This entity is not diagnosed properly. People think this is infection, then they go to probably a general surgeon or a vascular surgeon. They are good doctors, but they are not orthopedically trained, or they are not able to diagnose this condition properly, and they think it is infection, and they have it like an operation to do a debridement where we clean up the joints. Once you do this in a Charcot joint, it is a road to failure. Okay, so I would say India is the capital of diabetes in the world. The incidence of diabetes is increasing. Thereby, as orthopedic surgeon and me as a foot and ankle surgeon, my load of Charcot has increased significantly in the last 8 to 10 years. And my whole aim and purpose is to educate not only the public as well as the other my colleagues, doctors, that diagnose this condition properly. Because if you diagnose it properly, this is a one condition which can be managed very easily and properly in early conditions. While in later part, you need big surgeries, you need a long-term care for these patients, it's a big burden on the family and the society as a whole. And the rate of success is only 80%. So that means 20% is
Risk.
risk of failure in terms of the bones not joining, the limb not aligned, risk of infection leading to amputation. That's a very, very big risk.
Okay.
So, diabetes, do take care of yourself.
My mother-in-law is suffering with knee joint pains, but she's scared for the knee replacement surgery, and she's saying that I don't want to get surgery. I'll be on the tablets only. Is there any other remedy other than knee replacement surgery? Please suggest on that.
So knee replacement volume has increased significantly, and yes, people's awareness has become more and more. But I think we are going swinging on the other side, where people were not having surgeries to people mild knee pain, just have surgeries. And I think there are few centers in India which we call as just knee replacement factories. I wouldn't want to name names on this, but mild arthritis knee replacement, it's a solution for end all be all. I don't think so that's the right answer. There is definitely a big gap with patients or with people who have mild arthritis, who have pains, who do take mild painkillers but it's not settling down, but who are not ready for surgery or they don't need surgery. Now, what do we do for these kind of people? Of course, you always need to start with non-medical treatment in terms of non-tablet treatment. So, of course, exercise, weight loss, activities, maybe some time of knee brace or something. Change a little bit of activities. I think that is an important thing. And weight management, as I already told you, physical therapy. These are very, very important things. Then comes nutraceuticals, over-the-counter drugs you can take, glucosamine, chondroitin, rosehip extract, boswellia, curcumin. Curcumin is haldi. All these you do get over-the-counter in abroad. People have been taking it. Collagen is a new thing. No side effects or minimal side effects, can be taken easily. So these are the things which I think your mother or mother-in-law should be taking and doing it. Now, if she's already done it and still has some pain but not ready for surgery, if she's taking mild painkiller, it's okay. But I tell all my patients, they are managing with strong painkillers, okay, like NSAIDs, which can affect your kidneys, affect your liver. You can give gastritis, a big hole in your stomach. Now I tell people, you can buy a knee replacement in the market for 50, 60,000 rupees. Where are you going to buy a kidney? Who's going to give you a kidney? It is not tough, it is almost impossible. Liver, okay, if you have a liver failure, liver transplant cost is what? 75 lakhs, 1 crore or more. And to get it, and the whole lifetime suffering. It's a big thing. Instead, do other things. As I said, do this other stuff. Or if the pain is still there, then you have other options like hyaluronic gel injections. Those work very well. 6 months to 1 year is your lifespan. But if you do things which I have told you already along with the injection, it can last longer and can be repeated to an extent. To a time comes where the gel may not work. There are new modalities of treatment like your stem cell injections, and in the stem cell, what we call as a biologics. In biologics, you have something like a PRP, platelet-rich plasma. You have bone marrow injections. You have a stromal cell or visceral fat injection. Visceral fat has a good supply of stem cells. Okay, so again, minimally invasive, like you can take blood from your veins, spin it, inject it, do something, take you to the operation theatre, aspirate some fat or bone marrow, centrifuge it, concentrate it, and give to the knee. All are becoming new modalities of treatment. PRP in hair, face, black eyes, they have been doing it for years now. Same thing, I think, can be done safely for knee arthritis or ankle arthritis. They do work. Yes, there is evidence which is coming up. We have to explain there's a big counseling process for all my patients which we do it. And if they are ready, I think your mother-in-law should be looking at those options as well. And there's never no harm in that. Yes, there's no 100% guarantee with this, and it works for 2-3 years and it can be repeated again. So I think those are the things which you should be looking at.
Yeah, now my mother-in-law got many options other than knee replacement surgery. So as you said about the turmeric, till now we are concentrating on the external things like surgeries or exercising or physiotherapy. What kind of food we have to take for the strong joints or strong ankles or foot?
As I already said, exercise is very important because bone develops with stress. So the more you impact, the more it will become stronger. But along with it, you need nutrition. Good amount of nutrition is calcium, vitamin D. Calcium, good sources is milk, curd, butter, cheese. Okay, these are good sources. But people who are diabetics have to just take care what they're eating as well. Vitamin D, yes, good source is sun. You could sit in the sun, as much exposure of skin as you can for at least 1 to 2 hours, I would say in the morning, in the light sun, not too dark or something. Also, non-vegetarian sources is the fish. But what about vegetarian? I tell either you sit in the sun or have tablets. Tablets is a good source once a week, 12 weeks, I would say, and then once a month lifetime. I think that's a good thing. You need vitamin D for the calcium to get absorbed and deposited in the bone. Do not forget there are other trace elements which are bones are required, like magnesium, okay, zinc. These are two other things which are required, which you should be having on a regular basis. I would not say daily, but make sure you get that content. These are trace elements which are required. So all in all, these things should be taken care. Otherwise, no point doing other stuff. People are walking, but you don't have enough vitamin D, no point. Okay, that's what is important.
Parents are stressing on the children to be actively participate in the physical activities, mostly in the outdoor activities, because most of the children are addicted to the mobiles or TV. So what about the children who are actively participating in sports? What kind of injuries do they face and what are the remedies for them?
Yes, you should be pushy to your child, but make sure that you push in the right way. And as I said before, yes, you do your workload management, you push them, you strengthen them, but at the same time, focus on their balance, proprioception, their workload management. Give them time to recover. Okay, friend of mine whose daughter is now going into national tennis, I think she's been too pushy. The workload, there is a time where she is not able to do it because her shoulders hurt. We need time to take off for her to recover. Also, we need to get them access to cool baths or a ice sauna. I think that's a very good thing. So that's another workload management. Other coming to knees, get the make sure that they are aligned properly. Yes, you cannot change what the alignment is, but flat foot is another big thing. Okay, 20% of people in India are flat footed. Not everybody has symptoms. But if you're really going into active sports and your knees or your back starts hurting or your feet start hurting, you really need to look what you are doing in your footwear issues. Are you using the appropriate footwear? Are you using insoles or customized insoles? Have you been doing proper exercises for your flat foot? Those are very, very important things to consider, and especially people who are going towards a professional side. That's very, very important.
Recent developments related with the rheumatoid foot. Can you please enlighten on that?
Rheumatoid arthritis, I don't know if you guys know, it's like an autoimmune disease where your own blood or a body produces antibodies which goes and destroys your joints and ligaments and the cartilage. And that's a very basic understanding of stuff. And people come with joint pains, joint swelling, could be one joint or it could be multiple joints, usually affecting the hand and the small joints. But in foot and ankle, it affects the whole foot and can be ankle as well. So recently, because of the medical advances in rheumatology or rheumatoid arthritis management, we are not seeing as bad deformities which we were seeing 10 to 15 years ago. But again, we have a lot of people have burnout rheumatoid arthritis but bad deformities. In the past, we had big open surgeries where we had to do big scars and we had to take out the heads of the metatarsals and get the toe corrected. It was a big surgery where people took almost 6 months to recover. But with the advent of what we call as a minimally invasive surgery in foot and ankle, where we do a lot of corrections of the deformities or the deformed toes, By small cuts, like a less than a centimeter cuts, we can correct the whole foot deformity. That has really changed the management of patients with rheumatoid arthritis feet. I was the first one to introduce minimally invasive surgery in India. I got trained both in US and Europe and had surgeons coming and giving me hands-on training as well. So I've been fortunate. We've been doing that for the last 3 years in India, and we have got fantastic and great results for patients with rheumatological conditions and also other conditions like in diabetes, like in corns, callosities, or other deformities of the foot, where minimally invasive surgery works very well for them.
We do strengthening for our muscles, mainly concentrating on the upper body, but we neglect our joints or the lower foot and ankle. So what kind of exercises or routine we should take in order to avoid such kind of injuries?
What I would suggest is people who are starting to get into some form of exercises, and always most of the people, and especially younger people, always first thing they go is strengthening exercise. As you rightly said, upper body is strengthening, biceps, triceps, back, you have to do strengthening. I see a lot of my people as well coming with knees. They will go for thigh bench presses, calf raises, and all that stuff. However, as we age, we lose elasticity of muscle, okay, especially after the age of 35 and 40. So what we need to do is we need to stretch. Okay, so stretching is very, very important. Your hamstrings, which can over a period of time get tightened, your gluteus muscles, so the buttock muscles, hamstring muscles, your calf muscles, they become tight. So before you do any workouts, stretching of the muscles is very, very important. Having a good warm up is very, very important. And then you can do whatever work you want. You want to do bench presses, you want to do squats, you want to do lunges, all are fine. But listen to your body and always start slowly. That is the mantra. Always start slowly, and every week only increase your workload by 10 to 15%, not more than that. I get a lot of people saying day one or first week, or first few days they started with 20-minute walk. Next week they started with 45-minute walk, and they behold, they come with pain. Don't do that. Always gradually increase your workload, stretching or warm ups, do your workload, and then again warm down. So, again, end it with stretching and icing. Those are the few things which you should take care of yourself, and I'm sure you will enjoy your
So
workouts.
we generally choose footwear which is stylish rather than comfort. So how does this footwear plays a role in these joint pains or ankle or foot injuries?
And this is from a personal experience. My wife, one day when we moved from London, after a year, she said, let's go for shopping. And we were looking at getting a footwear for the Indian attire. And I scaled through the big super mall in Mumbai, and I could not get any good footwear, and this I'm talking a few years back, of course, which was comfortable, biomechanically sound, but at the same time looking stylish. Okay, so you cannot, and I was like, why is there such a big gap
So we
between
will
this?
not get that combination of comfort and
Yes,
stylish.
yes. So something which is good, your foot should be able to be comfortable where you can spend the whole day in it if you wish to, and the same time should look good. That combination is very rare. Even now I can tell you it's very rare. Okay, it's got better, but it's not common because most of the time the footwear was just a thin half a centimeter sole, two straps on the top which have a lot of embroideries of or diamonds dazzled on that. That's not a good footwear, because understand, your footwear should be holding to your feet and not your foot or your toes continuously holding your footwear. Because if that is the case, that means all your muscles are continuously active, and over a very short period of time you will start getting tired. Okay, also the other thing is, when you're buying a footwear, make sure you have a nice 1 to 2 centimeter of sole which is comfortable, which is actually taking the pressure off or taking the load and giving a good ground reaction force to it. Also, you need to make sure that it has multiple straps, right at the front and at the back if it can support it. One more thing which I observe when I travel a lot of women try it, always will be half a size smaller. It's always. And key thing is your footwear or the inside of your chappal or a footwear should be all around your foot. So your heel should not be hanging out of your chappal. or a sandal. Okay, that's another common mistake. Also understand what type of foot you have. Do you have a normal aligned foot? You have a flat foot, or you have a very high arch? And those are very easy tests to, and we will show you how you can test it, what type of footwear you have, and get those type of shoes if you want. So you have different types of shoes for flat foot, high arch, and a normal foot. Also, what activities you want your shoes or your footwear for. If you want for running is different, for walking is different, for any sports is different. So understand. So buy a correct footwear for your activities as well. Two last things I would say. When do you buy your footwear? Never buy it in the evening. Okay, because by evening your foot is slightly swollen, so you always may buy a size bigger. If you buy it in the morning, there is no swelling, so it will be shorter. The best time to buy a footwear is in the afternoon or very early evening, so you get the right size. And the last thing is, when you're wearing your footwear, and especially a closed footwear, your great or toes, which are the longest toes, should still have a half centimeter to wiggle inside your footwear. That's very important. Just don't go and buy something which is very attractive, on sale. Try to see if it is half a size smaller, you still be able to wriggle out. No, don't break into a shoe. Okay. And other thing, always try both sides. You will find that there is always a slide. One side of your foot is smaller than the other. Okay, always try both foot, both sides. Walk for 5 minutes. You should be comfortable. Then buy it.
So as you said about the footwear, I just want to add to it, like we women wear heels continuously. Like from the early age, we start wearing heels for any kind of occasion or to the office or anywhere. We love to wear heels because it enlightens our confidence also. So how will it affect our legs in the long run?
The psychological impact which has is phenomenal. Till date, I have not told any of my patients don't wear heels. Wear heels, but try to spend as minimal time as possible in the heels, especially if you're wearing stilettos. Long stilettos, be very careful, and always have few different pairs of heels with different sizes. Okay, so you could have a 2 inch, you could have a 1 inch, and you can have a 4 inch, but vary it. Shortest period of time spent on that, and do calf stretches. That's very important, because if you wear heels for a very long period of time, your calf will get short, they will get tight, and then you will have problems. So that's one thing for the heels. The second part is, along with the heels comes always a narrow toes. So narrow toes gives you a big problem, called as a bunion, also called as hallux valgus. Okay, because the toes are pushing, the front part is pushing all the toes crowding together. It's a big issue. In the western side, narrow toe heel shoes is the most common cause of bunions. In India, not so much. Yes, I'm seeing the big surge of patients with bunions in my practice coming for treatment. But one of the other causes of bunions in India is probably genetics or ligament laxities, which I've already spoken about. Now, what do we do with it? Do you treat? Tell the people don't wear it? Or do you see some do some other treatment? In India, most of the time, women, men, they go around it, change your footwear, try to wear open sandals, chappals, and they do not seek treatment. So that's why mild bunions to moderate bunions, people coming to seek treatment is very low, and having surgery is still very low. In the western side, I think most of the people with mild and moderate bunions, they have surgeries, full stop, because of the weather conditions, because of work conditions, and etc. India is slightly different, as I said. People go around it, but when you start getting one toe over the other, so the great toe coming over the second toe, or the second toe coming over the first toe, that is where people start getting problems, because then you can't wear footwear, you can't wear open footwear. If you want to travel, you want to wear a closed footwear, you will start getting corns. Also, you get a lot of callosities on the inside. That is the time people come to me and they said, I need something to be done. And I think that is the time to have surgery done, definitely. Now, what types of surgeries? Now, you do not need to lose the mobility. You can also have a corrections called as a bunion correction surgeries. Do for this. Now, before that, just reminded, I remembered, and a lot of things happening on Instagram on this. You have these fancy socks or splints for bunions. They do not work. I am not paid a consultant for anybody. they do not work. Okay, yes, when you wear it, it will be straight, it looks straight. The moment you stop using it, it will go back to its place. Okay, if you say I will wear 3 months 24/7 365, no, it will not work. That's literature, not new, it's been there in the literature, it does not work. So as I tell all my patients, either you live with it, work around it, or have surgeries. That's what it is. So when you have surgeries, initially I should do big open surgeries, break the bones, realign the bones, tighten the tissues, everything. Did well, recurrence rate of around 5% to 10% in 3 years to 5 years. But now, as I was talking about initially, I do minimally invasive surgeries, 2 or 3 cuts less than a centimeter. I can correct the whole bunion. They can walk from day one. There is no plaster. Now my patients having minimally invasive surgeries for bunions or anything need plaster. They can walk on heels from day one, and the outcome is very good. Okay, you can correct all the deformities of the bunion in the same thing. We have special screws which can fix it. The pain is less, mobility is better, outcomes are better. Also, literature suggests the recurrence rate, that means to have it back, is low as of now. So, it has revolutionized my treatment of bunions for patients with severe deformities. Now, there are some patients with severe deformities crossing over third toe, fourth toe with arthritis. In those patients, yes, you can still correct it, but sometimes you will need to sacrifice the joint. But it is still better than having a toe with claw toes, with corns, which gets infected, and then you need to lose that toe. So, I think if they're symptomatic, they should be treated appropriately.
Thank you so much, doctor, for sharing us this valuable information. Thank you once again.
Thank you so much for having me on this show. I hope the viewers have found all the information useful. If there's anything, they can always contact us. Thank you.